Hi, my name is Nicola and I'm one of the directors of Pelvic Health Melbourne Maidstone and one of our senior pelvic floor physios across all of our clinics. Today for Women's Health Week, I'd like to talk to you about pain during intimacy, also known as dyspareunia, and I know for a lot of people this can be a really sensitive topic. Painful sex is unfortunately not an uncommon experience for a lot of women or vaginal owners, and in fact up to 30% of this population will feel pain at some point across their lifetime. This pain can come on suddenly, never having been hinted of before, or it can be there from someone's first sexual experience. There are a few things that can increase the likelihood of someone developing dyspareunia, and a person's age and major life events such as pregnancy, childbirth and menopause can all influence this. I want to go through a few of these with you today, but please know that this is not an extensive list, nor should it be used as individual advice. If someone has felt pain from their earliest or very first sexual experience, this can be influenced by a number of things. Extra sensitive nerve endings around the entry to the vagina can be one of these, or a tight and overactive pelvic floor can also contribute. For some people, they may have a thickened hymen that can't be broken, and this can just be another reason for pain. Pregnancy and childbirth, as mentioned, is another life stage where pain risk increases. During pregnancy, big changes are happening in the body that allow for sustaining of life, accommodating growth, and preparing for birth. Because of this, your nervous system is working so hard, but as a result, it means it can become a little bit more sensitive. And if this happens around the entry to the vagina or the vagina itself, then this can cause pain. Pelvic floor muscles can also become tighter and more overactive during pregnancy, another trigger for pain, but also swelling, particularly around the vulva and pelvic region, can also increase someone's chance of experiencing dyspareunia. After birth, trauma to the pelvic floor and scar tissue can also play a role in pain provocation, and hormonal changes can influence vaginal tissue sensitivity. Another reason that someone might experience pain after having kids can actually be pelvic organ prolapse. Finally, perimenopause and menopause see big changes happening across the body as estrogen levels drop. Estrogen is one of our sex hormones that is important for a lot of things, most notably being ovulation, but it plays a vital role in vaginal tissue integrity. Estrogen is important to keep tissue well lubricated and tolerating of stretch. Unfortunately, when estrogen levels drop, this means that vaginal tissue can become drier, stiffer, and more sensitive. And for some, this can create the perfect storm for them experiencing pain. Painful sex can be really isolating and a heavy burden for any individual to carry, but it can also impact on relationships and stop someone going on to create a family of their own. Pelvic floor care can be a really great way to manage and even in a lot of cases resolve pain during intimacy. Speaking to a pelvic floor physio or osteo, your GP or a gynecologist can be a really great place to start. I know that talking about sex can be really uncomfortable for a lot of people, and particularly when pain is involved, but please know that you are not alone and that there is help available. If you'd like more information, please feel free to go to our website or give one of our clinics a call today. Thank you for watching and happy Women's Health Week, and I hope that this has been helpful for a lot of people.